Peace be to you all. Assalamu alaikum. This is Omar Abdul Malik, physician assistant, physician associate, and health educator. I would say physician assistant for 20 years. so it's hard for me to suddenly train myself to say physician associate. Anyway, I wanted to answer some questions that I received in the comment section of some of my videos, and one was what kind of patients do I see in the hospitalist? So for those of you guys that don't know, I'm a hospitalist PA. I've been doing that for the past 6 years. That's coming out of about 15 years of outpatient inner city clinic setting. So as a hospitalist, working with adults, most of my patients, obviously they're all adults, but most of them are, about, in their late 50s to mid 60s. So, kind of young, youngish baby boomers is what I would call them. And we have outliers, of course, folks who are 20s. Unfortunately, we've got homeboys from, have been shot. I work in a particular one of the more violent areas of DC. That's left anyway. So we take care of patients who have their status post multiple gunshot wound, and so those 20-year-old guys, yes, young brothers, unfortunately, that's what they are. And then patients who are in their 90s. So those tend to be outliers. But on average, the age group is late 50s to maybe mid 60s. So many of them have respiratory failure, what we call acute or chronic respiratory failure. So maybe they have a chronic condition like a COPD, is this the last one? Sorry, talking about my wife.
What did you say?
Is this the last, you're just doing one hill? Okay. And then, let's see what else. Emphysema, chronic bronchitis, severe asthma, long-term chronic asthma, things like that. Lung cancer in some cases. And a lot of these folks come to us after being stabilized at different hospitals. So the role of the hospitalist is to really kind of orchestrate a person's short-term hospital stay. Short-term being anywhere from 1 week to, in some cases, 4 to 6 weeks. And then either they go home when they're well enough, or they go to a skilled nursing facility. So our patients are people who maybe they were in a nursing home, or they were at home and had, they blacked out or something, or suddenly had severe shortness of breath. And then they went to the emergency room and then decompensated in the ER and had to be intubated. So they stick a tube down your trachea and put you on these mechanical ventilators that we've been hearing a lot about COVID. Yeah, we have patients who had COVID also. So after being intubated, some of them have to be trached. So they get tracheostomies if they fell weaning from the mechanical intubation. And they're transferred to our hospital after they're stable enough. And they get respiratory therapy, physical therapy, speech swallow therapy, occupational therapy if they need it, and then a course of IV antibiotics if they require that. And the folks who are on antibiotics for a long time are usually people who have sacral wounds, or things like osteomyelitis, so bone infection in in their foot ulcers. So there are people who have got other morbidities like long-term poorly controlled diabetes, type 2 diabetes, hypertension, things like that. And they need, if they have chronic kidney disease, they may need to be on dialysis. So there's a lot of morbidities some of the patients have. So I can tell you, being a hospitalist PA in particular, you have to be really good at understanding your basic sciences in PA school, like anatomy, physiology, pharmacology. You have to have a particularly good understanding of pathophysiology. So, how the disease process in people. Why does type 2 diabetes, why can it lead to things like retinopathy and nephropathy, paresthesias? Pharmacology, of course, how would you treat that with pharmaceuticals? Now, having said that, we are trained on the allopathic model, which is the so-called Western medicine. So I don't speak about natural medicine. I've been admonished about that by certain people. Practice natural medicine. I don't know. That's not my training. And I'm a big advocate of preventative health care. So my wife and I are doing power walks on this very nice long hill. We're both in our 50s and we're trying to avoid being in the hospital at any cost. So we try to get our diet and exercise regimen going, so we can be healthy for our kids. But back to being a hospitalist, you also have to be really good at dealing with family members, because the family members may need a lot of education about their loved one's disease. They may have expectations about their family members that aren't realistic. People who are on mechanical ventilation may not be able to come off that mechanical ventilation. They may not be, if they have something called a trach collar, where they're not on mechanical ventilation, but they have the trach tube in, and they're hooked up to wall oxygen. This is hard. They may not be candidates for decannulation, so that's where they take the trach tube out. Some people may not be able to come off of dialysis if they have chronic kidney disease. So families need to understand that when their loved one comes to see us, their current state of health may be their new baseline. I talked about baseline in another video. And that may be the cause of a lot of angst and anger, which is imparted upon me as the clinician. Some people think they know more about medicine than they actually do. I said, well, I happen to be in the medical field, and you don't know what you're talking about. I want to see the doctor. So I introduce them to my supervising physician, who tells them the same thing that I just spent the past 20 minutes telling them. And you have to be able to kind of absorb that negative energy that's coming your way from the family members, and just understand that it's not them being angry at you per se, as they're angry about the situation of their loved one being hospitalized and then possibly having to be in a nursing home, or in some cases adult parents have got to come live with their adult children, and the adult kids don't always like that. But that's all for now. If you have any more questions, I'll be happy to answer them in the comments section. If you're interested in being a PA like me, I'll do what I can to help you get into and through PA school. I'm an erstwhile PA professor and admissions committee member. Okay, I wish you guys the best of success in your positive endeavors, and try to plan for 2022, because it's coming. Take care. Peace. I'm going to turn off.